Okay. Hi, everyone. My name is Melissa Fowler, and we are students part of the Nursing 401 Childhood Development and Health Promotion, and then we are going to present on common respiratory illnesses in children for you all. So biggest thing, we are already in winter, late fall into winter. It gets colder. You have germs everywhere. You guys are inside more. So sometimes we have higher respiratory illnesses, especially with your little ones at home too. Okay, so some common illnesses, especially the younger children we see are RSV, or respiratory syncytial virus, rhinovirus, human metapneumovirus, and obviously the flu. And these are all upper respiratory illnesses that last on average about 0 to 10 days if your child were to get it. What do you need to know about rhinovirus? It's an upper respiratory infection, like I said earlier, and it's the nose. Rhino means nose, and it is the most common cause of the everyday cold. So us being older, it might not affect us as much as it does those little ones. It could become severe if it's not treated, and it easily occurs any time of year, but especially in the colder months that we're in right now. Obviously, also the fall and the spring at each end of those colder months. It easily passes from person to person, especially sneezing, touching, and coughing. What do we need to know about the flu? You have different types of flu, types A, B, and C. A and B are the most common. They're highly contagious respiratory viruses that can spread via close contact, lots of hugging, kissing of your children, sneezing, talking, any of that really. There's an increased chance of getting the flu. Flu season is highest right now in December and then can go all the way through February or even March. So those colder months again. And then children less than 2 years old are the greatest risk for it. We do have the annual flu vaccine for children greater than 6 months of age that does help to prevent spread and contracting the flu. And just a little warning, the first dose that a child gets of the flu vaccine is split into 2. So they would get one, let's say in November, and then the next dose for that first part would be the next month in December. Now we have respiratory syncytial virus, or RSV. It causes mild cold-like symptoms in healthier older children, but again, those younger kiddos, it can really hit them hard because they don't have as high of an immune system, and especially in those colder months, it can be very serious for them. It causes what we call bronchiolitis, which is inflamed small airways, especially because they're also smaller. It's very easy for that area to get inflamed, so the airways in the lungs. And then there's an increased risk for pneumonia in infants less than 1 year old. And then almost all children by 2 years of age, even depending on the severity of RSV, it's most likely that a child will have had RSV. Some get hospitalized and some you just treat at home. And lastly, we're going to cover human metapneumovirus. It can also cause illness in the upper and lower lungs. It's again common in children less than 2 years. So like we said, most of these illnesses are really rampant and cause severe illness, or more common in kiddos less than 2. This disease actually was discovered in 2001. So it's a little more recent, but it's very related to what we just talked about, RSV. And it also mostly occurs in late winter and early spring. And it's again spread by close contact with someone who's infected. So coughing, sneezing, touching infected objects as well. So all of these diseases are very common, very similar, but very important to know and be aware of with your younger ones. So now we're going to go into mild symptoms and home remedies.
Hi everyone, my name is Batoul and I'm going to talk about mild symptoms management and home remedies. So as you can tell from Melissa's part, almost all the conditions have the same symptoms with some variations. We're going to go through and talk about management of each symptom separately. But first, overall, you should always make sure your baby gets extra rest, drinks water or other liquids as their uh, like milk or formula, depending on their age as well. And then you have to make sure that you hydrate them because dehydration can take serious consequences as babies tend to lose fluids more than adults. And lastly, watch your baby closely, monitor their temperature and overall symptoms frequently in case you note any of what is going on to be discussed after my part so you can seek medical attention. After that, we're going to talk about each symptom, and the first one is how to manage stuffy nose. So nose drops or spray, use salt water, saline, or spray 1 to 2 drops each nostril. For infants, a rubber suction should be used to clear out the extra drops or spray. So to use the bulb syringe, you should first squeeze the bulb part of the syringe. You gently stick the rubber tip into the nostril and then slowly let go of the bulb so it can suction and clear out whatever is blocking the nose. The most important thing is to make sure you suction before feeding so babies can breathe better while feeding. And also some like when the babies as they get older, they're gonna fight the bulb. So but it's important that you do the saline so it loosen up and they breathe better. After that, we're gonna talk about humidifier. So to help thinning the liquid that is making the stuffy nose, you should use a cool mist humidifier in the room. Some notes on using the humidifier. You should carefully clean and dry the humidifier daily to clean any microbes and make sure that the germs are cleaned. And also you should put it to close to your baby, but safely out of their reach, and also avoid water vaporizers to avoid any accident for the sake of safety. After that, as for the medications, acetaminophen or ibuprofen, dose as recommended based on the height and weight of your baby. This will help in either controlling the temperature to make them more comfortable or make them more comfortable, sorry, as a side effect of the other symptoms. But please, you should always know that ibuprofen should not be given if the baby is dehydrated or vomiting, or the baby must be 6 months or older to be administered ibuprofen. Always avoid any over-the-counter cough and cold medication. They can cause serious symptoms. And lastly, just keep in mind antibiotics do not work for cold symptoms or any infection that caused by a virus. You should not give your baby any antibiotic unless it is prescribed by your healthcare provider. Next, for cough management, honey, 2 to 5 mLs, that equals a half or 1 teaspoon as needed to thin the mucus and loosen the cough. Honey should not be given to babies before they are 1 year old. And lastly, mentholated rub. Rub a thick layer on the skin over the chest and neck for babies over 2 years to help relieving their cough. That was it for the mild symptoms.
Hi, I'm Kelsey. I'm going to go over when to seek medical help. So when to call the doctor for more serious symptoms or when you should take your baby or child straight to the emergency department. So some things to look out for, just to ask your doctor for extra feedback or to evaluate your child are a fever over 100.4, if they're having any difficulty feeding or if they refuse to drink anything or eat anything, if they're having less wet diapers than usual, any illness in babies that are younger than 4 months, you usually want the doctor to know, even if there's mild symptoms, just because when the babies are younger, it is more important for them to stay hydrated and easier for them to become dehydrated more quickly. So if your baby is less than 4 months and is exhibiting any of the symptoms that Batoul talked about, it is important to still call the doctor. But over 4 months, any of those mild symptoms you can manage the way that Batoul went over with you guys. Another thing to call the doctor about is if your child is just not acting like him or herself, if there's any behavior changes, if the cough lasts for more than 2 weeks with all of the management that Batoul mentioned and isn't getting any better, if they're irritable, or if they start exhibiting a rash with their fever. In terms of more serious symptoms that you would want to take your baby to the emergency room right away, if they become confused or stops responding to you, that's very important. If they have any change in mental status, to bring them straight to the emergency department. If they have any trouble breathing or have to work hard to breathe. So the illustration on the right, I know it's kind of hard to read, but I felt like it was a good picture of things that you would look for babies and children that are having difficulties breathing. So if you look on the shoulders and down underneath on the stomach area, those are what are called retractions. So if the breathing is pulling in those areas, then that is telling us that they're working very hard to breathe and using their muscles to help them breathe instead of just their lungs. So that gives us an idea that they're having a little bit of trouble breathing. Another thing that we can look for is nasal flaring. So you would look at their nostrils, and their nostrils would go outwards when they're breathing with each breath. That also gives us an idea that they're working pretty hard to breathe. And then we would also look for some bluish tints around their lips or on their skin. If you look at the middle photo down at the bottom, that gives you a good idea of what that would look like. It's what we would call cyanosis. So some blueness around the lips just means that the oxygen isn't perfusing to where we would expect it to. So they're having some difficulties breathing. And then if they don't have tears when they're crying, if it's an infant, that would give us a sign that they're severely dehydrated and need to come to the emergency department to get some extra fluids. So if your child does need to be hospitalized for a respiratory illness, obviously it's a very stressful experience. So we just wanted to give you a little bit of an overview of what you might expect to see when they're there. So when the child is in the hospital, they will be monitored. Their vital signs will be monitored, their heart rate, pulse oximetry, so looking at the oxygenation in the blood, their respiration, so their breathing, their temperature, and their blood pressure. So they'll be consistently monitored. If you look at the bottom picture on the right, a lot of those stickers and wires are monitoring all of those vital signs. So even though it looks kind of scary, those are all things that are just telling us and giving us more information about what's going on inside of your child's body. Another thing that you can expect is potentially isolation precautions. So if your child has a virus that we don't want to pass to others, they could be in isolation. So that would mean that we would use gowns and masks and extra protective equipment for sometimes the families, definitely the nurses and the doctors, and we wouldn't want the child leaving the room so that they don't continue to spread whatever virus that they have to other children. We might also potentially limit visitors depending on what the child has, especially during COVID right now. And then obviously hand hygiene is very important. So you would want to wash your hands with alcohol-based sanitizer and or at the sink every time that you walk in or out of the room. And you should ask everybody who comes in and out of the room to do so as well. Other things, medications, they might be given orally or into a vein. So with an IV, if you look at the top photo, that's a picture of what you might see for an IV. We give some fluids through that. just to keep the baby or child hydrated, as well as give some medications through there that'll go straight into their bloodstream. We can also sometimes put kids on breathing support, so a nasal cannula, which is what we usually see if you're watching a TV show and you see that there's something in somebody's nose, or down at the bottom right hand corner of that picture, he has a nasal cannula in as well. And sometimes if it is severe, then they might need a ventilator, which would include putting a tube down the patient's throat to help them breathe. And then for prevention, this is obviously something that we have talked a lot about during this COVID season, but we should be doing this really every year, especially during flu season. So we want to use good hand hygiene, like we were talking about earlier, with soap and water or alcohol-based sanitizer. It's important to avoid people who are sick, especially if you have a baby at home who hasn't necessarily had their vaccines yet. You don't want people who are sick coming into your house. And then if you do have any sick children, you want to keep them home from daycare and school. And if you're sick, then want to stay home from work, just so that you're not spreading that around to other children. Avoid smoking in the child's home. That will definitely impact their breathing and increases the susceptibility to getting some of these viruses that are spread respiratory. Obviously, we want to vaccinate our children. The babies sometimes aren't vaccinated yet because they're too little. So again, just make sure and be mindful of other children who are sick, or adults who are sick coming into the home. COVID precautions while we're still in COVID. Obviously, we want to wear our masks for things that are spread droplet or airborne. COVID is droplets, so we would want to keep our masks on so that we're not spreading those droplets from our breathing to others. And then just keeping our common areas clean. The areas where people are touching most commonly, you want to make sure that you're wiping that down with Lysol or alcohol-based cleaning supplies that are safe for children. And then
we have some, sorry, Kelsey.
Go ahead.
We do have some take-home points for you guys. A very small, easy quiz, just to see kind of the information that you guys did collect from this presentation. So the first question would be to list 2 of the common respiratory diseases that I presented on. There were 4. And then the next question here is true or false. Mild symptoms for common respiratory illnesses include tugging in of the chest muscles, breathing fast, and a blue color to the child's face. True or false? The next question, true or false? Honey is a good cough relief for my 6-month-old. Is that age appropriate? Fill in the blank. Make sure to blank before feedings so babies can breathe better while they eat. What do we do to help them breathe better? And then give a couple examples of instances where you would call the doctor. There are a lot of answers for this. We just want a couple to have you remember so that we can kind of gauge the information that you all retained. I'll give you a minute. You can pause the video, and then this next slide, we will go over the answers. Okay, so hopefully you guys paused the video. You kind of thought about this presentation, and here are your answers. So again, not very hard. List 2 of the most common respiratory diseases presented. So there was rhinovirus, influenza, RSV, and human metapneumovirus. All very similar, but very serious, possibly serious respiratory illnesses for your young ones. And then true or false, this question was false. So mild symptoms for common respiratory illnesses would be the, oh boy, help me out, friends.
Be like a stuffy nose, a mild cough,
Yes.
mild fever, tugging in your chest muscles, breathing fast, and a blue color to the face is an emergency. So we wouldn't say that those are mild symptoms for respiratory illnesses. We would want to bring them to the emergency department right away.
Yes. Thank you, Kelsey. It's been a long day. Next question, true or false? Honey is a good cough relief for my 6-month-old. Honey is not to be used for those kids less than at least 1 year of age. It's even better for kids 2 years and over. And then fill in the blank, make sure to suction. Use that bulb suction, especially before feedings, so babies have a clear nasal passage when they eat. If you don't suction and they're very congested and you give them feeding, it's like when we are congested as well. We can't eat and breathe at the same time. So if you're plugging, if their nose is plugged and they're eating, there's no way for them to breathe. So suctioning is very useful in clearing that nasal passage, letting them eat and breathe at the same time so they're not in any distress. And then the last thing, give a couple examples of instances where you would call the doctor. Again, if there's a fever over 100.4, if they're having feeding intolerance or difficulty eating, making less wet diapers. And again, we did not put this here, but like Kelsey said, any child or infant less than 4 months old, just let the doctor know that they are showing even the mildest of symptoms so someone's aware and we can continue to watch that child further. And these are our references. Thank you guys so much. We hope this presentation helped. Obviously with COVID, there's a lot of other things on our minds, but these 4 respiratory illnesses are still very common with your children and you need to be aware of them. The care that you can do at home versus the care and extra help that the hospital or your doctor can do with you. So we thank you all so much and have a very safe next few months.